Hi everyone, I would like to discuss today on a contemporary issue in education, focusing on social and emotional learning (SEL). My name is ThaZin. The issue that I want to discuss is that performativity versus caring in nursing education. So this one focus on the conflict between performativity and social emotional learning in education, especially in the clinical setting. Standardized assessment system prioritize measurable outcome such as task completion, skill sign-off, measurable performance, then often neglecting students' emotional experience and identities. This reflects a standardized education model where learning is treated as measurable output rather than meaningful participation, that David mentioned. So as a result, students who demonstrate relational care or require emotional support may be disadvantaged, raising concern about equity and inclusion in education. So competence without SEL produce efficiency, no doubt, but not humanistic care. So the background of this issue. So this issue has emerged due to the increasing emphasis on accountability, standardization, and measurable outcomes in education system. So in response to demand for quality assurance and comparability, educational institutions, especially in healthcare, have adopted competency-based frameworks. This prioritize observable and measurable performance. So historically, this can be traced onto the shift of educational thinking, why learning is conceptualized as acquisition, meaning knowledge is something that can be measured, transferred, and assessed through standardized criteria. From David. Yes, I agree. Standardized assessment privilege what is measurable. But why? SEL competency and care practices remain invisible, creating inequity in how nursing students are evaluated. So this has reinforced a performance-driven culture, particularly in high-stake environments like clinical education. So recent data suggested that while clinical performance and placements essential for building confidence, skills, and professional identity, students' experience are significantly influenced by level of anxiety, support, and perceived inclusion that highlighted from Limbs et al. 2020. So why assessment systems are overly rigid? That may reduce confidence and hinder authentic engagement. That's why, as a broader level, policy framework such as UNESCO's Education 2030 Agenda have emphasized that the need for inclusive and equitable education, highlighting that importance of integrating social and emotional learning in education system. The dominance of standardization and clinical assessment, however, there remain a gap between this policy ideal and actual practices. So this issue is influenced by multiple systems like including educational system, prioritizing standardization, benchmarking, healthcare system, emphasizing safety, efficiency, and competency, and public and economic pressure like demanding accountability, measurable outcome. So as a result, while systems aim to ensure quality and safety that may be unintentionally marginalize students' identity, emotional experience, and sense of belonging. So why it matters? Passion and power relation, measurable versus meaningful. This issue matters because it raises a critical question in education, particularly in Singapore. Are we prioritizing meaningful learning or are we chasing performance indicators such as student feedback, rating itself? In Singapore, students' feedback is an important mechanism used to evaluate clinical learning environment and institution. Why? This support quality assurance. It can and intentionally shift the focus towards achieving positive rating rather than fostering deep reflective learning. So institutes define what counts as a system, reward what can be measured. So the consequences of this include educator may prioritize students' satisfaction over critical and transformative learning experiences. Learning may become surface level, aligned with measurable expectation rather than authentic understanding. So students may struggle to develop clinical judgment, confidence, and professional identity. So students who complete all the tasks fit into the systems and they succeed. Others may be risk becoming unheard or invisible. So I would like to highlight that from an equity perspective, this is critical because a sense of belonging is strongly linked to motivation, achievement, and retention that mentioned by Brown et al. 2025. One system prioritizes performance. Students who do not conform to standard expectation may feel excluded or undervalued. So if unaddressed, this may lead to a culture of performing to pass rather than learning to practice. So that may increase burnout and disengagement. Reinforcement of system where what is measurable is prioritized over what is meaningful that Glenn et al. Mentioned that we have to pay attention to it. If measurement is prioritized by what is meaningful. So you see from this figure, the reflection that I would like to highlight, one success is defined by metrics, whose learning is recognized and who is overlooked. Are we producing strong evaluation results or truly preparing safe, thoughtful, and compassionate nurses? If we measure only what is visible, we may miss what truly matters in care. So on top, all the competency, performance, then below, our identity, emotion, experiences, attitude. How are we going to include in their educational spectrum? So Sam, what count as good education then? So efficiency versus humanity, measurement versus meaning, system needs versus student needs. Okay, let's talk about it. Some argue that standardized assessment systems are necessary to ensure fairness, consistency, and patient safety, particularly in high-stake professionals such as healthcare. We agree. From a policy institutional perspective, measurable outcomes provide accountability and allow comparison across learners and institutions so we can benchmark. Also agree. So in contrast, from a social and emotional learning SEL and ethic of care perspective, learning is understood as relational identity based. So Brown et al. Mentioned that perspective emphasized that the students require psychological safety, belonging, and meaningful engagement to develop as competent and compassionate professional. So this creates tension between efficiency and humanity. System focus on what can be measured but may miss what is meaningful. So are we designing the system that serve the learner or learner that serve the system? Who benefit? One learning is reduced to metrics. We need to think about that. So simply put into these two paradigms in nursing pedagogy. So these frames are not neutral, they shape what is valued, taught, and assessed. So from critical perspective, the highlights in power relation within education system, where institution determines that what count as values knowledge and whose performance is recognized as a result. Students who align with the measurable criteria, yes, benefit. Students who require relational or contextual learning support may be marginalized. So Glenitz et al. Mentioned that accountability system assume quality can be measured. Yes, I've been repeating, but not every important things can be measured. So this raises a critical equity question again. So this infographic highlighted that system needs and student needs, performance model and SEL model, measurable and meaning. So Elmondsoft et al. That mentioned that in this infographic, I highlighted that 51% of students experience psychological distress. And then the stress itself is 65%, burnout 60% are most common, and 32% experience depression and anxiety, especially this percentage just from the study that they conducted for the health care students. So stress and burnout are about twice as common as depression and anxiety. So more than half of students face distress with stress and burnout. So the key message of this infographic is it's that balancing metrics and humanity is vitally important. The statistic which we cannot ignore is more than half of learner having burnout, with 1/3 of learner having depression and anxiety, which is alarming. I want everyone to understand that as educator, we should take a student-centered approach, looking beyond the tip of the iceberg and use social and emotional learning to support a more holistic way of teaching and learning. This is just to highlight that importance of SEL. In many settings, learning is very task-focused and performance-driven. Students focus on completing and meeting criteria, task and meeting criteria. So SEL help us shift the focus from what the student does to who the student is. The diagram highlights three key areas: that relational learning, how students connect with others, emotional well-being, feeling safe and supported, identity and belonging, feeling valued. Once these three come together, learning becomes more meaningful and holistic. So as educator, we should not only assess performance, but also support the whole student. So task-oriented performance tool there, SEL offers pedagogical counterweight. It shifts focus from what student does to who a student is and how they connect. This page is purely focusing on seeing the student beyond performance with my true experience. So that I just want to highlight, as a nurse educator, I started to ask myself, are we helping the student to grow, or are we just deciding the outcome based on my experience? Thank you very much for your attention so far, and I would like to close and end these sessions with these questions. Are we producing good evaluations, or are we producing good nurses? Is we need to think about it, and how can we move beyond and work towards that.